AxoTrack virtual needle technology, incorporated into an ultrasound probe, combines traditional ultrasound with magnetic sensing technology to provide a revolutionary needle visualization and guidance system. This technology can be used for procedures that require ultrasound needle guidance, such as central venous access, cyst aspiration, arthrocentesis, biopsy, and nerve blocks. First, let's look at an AxoTrack-equipped ultrasound probe. The probe has an ergonomic design that gives it a look different than a typical probe. It has a standard ultrasound transducer with a needle guide integrated into the probe body. Built into the vertical post is an array of magnetic sensors that facilitates needle visualization. These sensors precisely sense the position of a magnet mounted on the hub of the needle included in an AxoTrack sterile procedure kit. This is the AxoTrack sterile procedure kit. In it is the needle with a magnet mounted on the needle hub. The other components of the procedure kit function to maintain a sterile barrier. Included in the kit are a two-piece probe shield with an integrated needle guide and needle clamp, a cable sleeve, and elastic bands to secure the cable sleeve in place. This is the probe with the probe shield fully assembled. This is where the ultrasound transducer is positioned, and this is the opening of the needle guide. On the top side is the entry to the needle guide and the needle clamp, which can be rotated with the thumb or forefinger to secure the needle when desired. As the needle is passed through the needle guide, the sensors in the probe precisely monitor the position of the magnet on the needle. The system automatically combines the magnet location information from the magnetic sensors with the ultrasound images acquired from the beamformer to produce a virtual image of the needle on the sonogram in real time. You can see that the virtual needle mirrors the motion of the actual needle. The AxoTrack system consists of AxoTrack virtual needle technology within an ultrasound probe and an AxoTrack sterile procedure kit. Here is a demonstration of the AxoTrack system in use. The practitioner finds the target, whether it be a vein, a cyst, a nerve bundle, or solid mass, and simply aligns the target line with the anatomic target, advances the needle through the needle guide, and observes the virtual needle as it approaches and penetrates the target in real time. At this point, the needle lock can be actuated, locking the needle in place to facilitate guide wire feeding, drug delivery, or aspiration. Assembly of the probe shield is simple, but requires care to avoid contamination of the sterile field. First, the kit is removed from the box and placed on a stable surface with the white side down. Without touching the kit inside, the clear plastic is peeled away, leaving the tray on the sterile white backing. At this point, the practitioner puts on sterile gloves. The assistant applies a pea-sized volume of ultrasound gel to the acoustic window on the probe and lowers the probe into the bottom half of the probe shield until it is fully seated. Care must be used to avoid contaminating the practitioner's sterile gloves. The protective cap is gently removed by the non-sterile assistant, using care to avoid touching the sterile bottom shield. The practitioner then slides the top half of the sterile shield down over the probe and snaps it in place simultaneously at the front and rear of the shield. There should be a firm audible click when the two halves lock together. To install the cable sleeve, the assistant holds the probe by the cable and lowers it into the cable sleeve being held by the practitioner. The sleeve is carefully fed over the cable by the practitioner until the distal end reaches the probe where it's secured to the probe handle with the elastic band in the kit. As a final check before use, the practitioner passes the needle through the needle guide and observes when the needle tip starts to protrude from the bottom of the probe shield. At this point, the image of the virtual needle should be seen just entering the very top of the ultrasound field. This step assures calibration is correct. Finally, the practitioner slides the needle slowly back and forth through the needle guide and observes the virtual needle on the sonogram. The motion of the virtual needle should mirror the motion of the actual needle. If either of these system checks fails, the practitioner should stop the procedure and refer to the probe user guide. The AxoTrack equipped probe with probe shield has an ergonomic design that allows it to be held securely, facilitating accurate needle guidance. The probe can be held in either hand, with the vertical post pressed into the dorsal first web space. The finger grip on the probe handle is then gripped with the middle finger, leaving the forefinger and thumb to act as stabilizers on the surface of the body. Once the anatomic target is located and aligned with the target line, the practitioner places the needle in the needle guide. This is most easily accomplished if the magnet is first placed against the magnet rail to stabilize the needle as the needle tip enters the top of the needle guide. The needle clamp must be in the open position, or the needle guide will be occluded. The needle can then be advanced in a controlled, deliberate manner to the target. The magnet should be kept against the magnet rail at all times. If the magnet is bent away from the magnet rail, a bold warning arrow will appear on the sonogram, indicating that the magnet should be returned to its proper location. If the needle is bent too forcefully away from the magnet rail, the virtual needle will disappear completely, preventing continuation of the procedure. The practitioner should not attempt to reposition the needle or target line without withdrawing the needle to the skin surface. Once this is done, it will be safe to realign the target line and advance the needle to a different target. Correct needle position must be confirmed by the appropriate clinical indicator. For example, for vascular access, blood return in the syringe. For arthrocentesis, synovial fluid return. For nerve block, anesthetic observed to infiltrate in the appropriate anatomic space. When the needle is in the appropriate position, the practitioner can actuate the needle lock with the thumb or forefinger to hold the needle in place, thus facilitating guide wire feeding, drug delivery, or aspiration. When using the AxoTrack-equipped ultrasound probe with virtual needle technology, it is important to understand the relationship between the orientation of the ultrasound probe, the scan plane, and the trajectory of the needle. Note that the trajectory of the needle always lies within the scan plane and corresponds to the direction that the probe is aimed or pointed. The probe does not have to be oriented perpendicular to the body. It can be tipped or angled to find the appropriate window for safe needle penetration, providing tremendous flexibility when approaching needle-guided procedures. Placing the probe on an angle to the body surface is particularly important when performing vascular access. To facilitate guide wire passage, it is desired to impinge the target vessel at an angle 30 to 45 degrees off perpendicular. This requires tipping or leaning the probe on the body surface to provide the desired angular approach to the target vessel. Placing the probe at the desired angle is easily done when approaching either the internal jugular or subclavian vein. Having the ability to easily and accurately locate the probe in the optimum orientation on the body surface also provides flexibility when performing nerve blocks, arthrocentesis, and other procedures. As you can see, the AxoTrack system is simple, accurate, and intuitive. Use of an AxoTrack-equipped probe with virtual needle technology results in increased clinical confidence, fewer sticks, reduced procedure time, and improve procedural outcome. The AxoTrack system is safe, simple, and cost-effective for patients, physicians, and hospitals. For more information, visit our website at somaaccesssystems.com.